Tell us what KYPHA does.
KYPHA is developing proprietary point-of-care blood tests for autoimmune and inflammatory disorders.
So, what can you do with a better understanding of inflammation, particularly in the bloodstream, and how does that help you do what you're trying to accomplish?
Sure. Well, inflammation is involved in just about every aspect of human health and disease. So the ability to monitor it in real time with greater accuracy has broad clinical utility. Everything from autoimmune diseases like lupus, where a patient is trying to understand if their disease is getting better or worse, to traumatic injuries and infection. For instance, critical care environment, where physicians are trying to understand whether the patient's getting better or worse, how to treat them, when to treat them, whether they've stabilized and can be discharged, things like that.
And right now, what kind of clinical partners are you working on to further the technology you're using?
Sure. So we developed the product first so that we could deploy it in the clinical setting and actually generate real clinical data on real patients. And so we have focused on building out a clinical program from coast to coast, everywhere from the Harvards and Hopkins on the East Coast to the Stanfords on the West Coast, and a lot in between, including right here in our backyard in St. Louis. So we typically will deploy the tests in a reader, which we use to get quantitative results to those clinical collaborators, and looking at a variety of the different indications where inflammation is particularly important, the autoimmune diseases as well as the critical care environment, demonstrating both the product has utility at the bedside and at the patient's side, as well as the biomarkers that we're looking at to measure inflammation more accurately, the validity and the clinical utility of both the product and the biomarkers.